My name is Dr. Terry Ruddy. I'm Director of Nuclear Cardiology at the University of Ottawa Heart Institute in Ottawa. ASNC has been very successful having personalized meetings where you actually get to talk to the faculty. The faculty are world-renowned experts in nuclear cardiology. So you get the chance to talk to someone specifically and ask questions that are very relevant to your practice at home. The cases chosen also are very typical of the material you would see in your own workstation at home that you can then interpret in a way that would be useful to the clinicians that you are working with. There's several big areas. PET, as always, is big because PET is being promoted. It really is, in many ways, the future of nuclear cardiology. And the key area of PET that's very helpful is PET blood flow. PET blood flow is difficult to actually interpret in many patients. So the more experience, the more opportunity you have to ask questions about PET blood flow, the better you can actually interpret and use it in your reports. The other area that's very hot now is SPECT. SPECT is very traditional. We've done SPECT forever. SPECT is changing though. We're doing molecular imaging with SPECT. The hot area is amyloidosis. Turns out amyloidosis, it's an infiltrative cardiomyopathy. It's much more common than people think. It also looks like it will be treatable. So it was an untreatable disease, say 5-10 years ago, but now there are phase 3 studies coming out that show treatment for amyloidosis. And it can be diagnosed most accurately, most definitively with pyrophosphate imaging, which is a SPECT technique, something we did 20 years ago, something we can all do. You can do it in a tiny little city with a small clinic and do the same type of studies you could do in a world-class academic center using pyrophosphate imaging with SPECT. So that's very hot. So it's something we haven't done for 20 years. So there's a bit of a learning curve. There's a learning curve for technologists, for physicians, also for referring docs. They'll have to get used to whatever reports we put out, which will have to be developed for the referring docs. Our technologists have to be brought up to speed in how to do pyrophosphate imaging with current technology, which is actually better than older technology. Pyrophosphate imaging was done with planar imaging. Now it's SPECT imaging. So SPECT imaging of pyro is actually a new spin on an old technique. So SPECT pyrophosphate imaging will be very hot. And then there'll be more academic directions, like there are new PET tracers coming out for amyloidosis, which may be more specific for types of amyloidosis, and in that way personalized selection of patients for various treatments. So nuclear cardiology is expanding, growing. And it's growing in simple ways, like with SPECT imaging, or more complex areas like PET imaging. So you really want to be state-of-the-art. You want to be able to do this type of work yourself. And to do that, you have to come to a meeting like ASNC, where you've got workstations, you have the experts. You can bring your difficult cases and say, gee, this didn't fit. How do you explain this? Then you'll have a world expert on amyloidosis say, gee, well, it works like this. And you'll suddenly understand, yes. And the light bulb will go on.